Good morning. So, my name is Ashley, and this morning I'm going to start our presentation on asthma. This presentation was worked on by three students myself, Carly, and Rebecca. So, to start it off, I'm going to give you a general definition of asthma. Asthma is a chronic disease that affects the airways and the lungs. It the airways are normally inflamed or can be inflamed with people who have asthma. The airways are very sensitive. It can react to allergens in the air or different chemical irritations or just environmental irritations. There is no cure for asthma at all. Proper diagnosis, treatment, and management can minimize the episodes and exacerbations of asthma. Um, the symptoms of asthma can include wheezing, coughing, the feeling of chest tightness, because the airways are starting to close down and clamp down the muscles in them. Um, when that happens, sometimes your other organs that need the oxygen don't exactly get the oxygen they need because the airways are so clamped down you're not getting all the oxygen you need in your body. A lot of patients have what we call allergic asthma, which means that it's set off by some sort of allergen, which can include mites, mold, animal dander, pollen, and even cockroaches, which was the first one for me to hear. And they can all make asthma worse. Some other things that set off asthma are when it's on exertion, like playing a sport, exercising, a lot of walking, a lot of talking, um, and that's caused exercise-induced bronchoconstriction. Asthma can be diagnosed in childhood, but lately providers are not trying to diagnose it as asthma. They are diagnosing it as reactive airway disease because it makes it harder for the child later on to get covered by other insurance policies if it's not on a mom or dad's or a life insurance policy, because the tag of asthma automatically sets them up later to have to jump through 10 million and one hoops to get onto life insurance or any other kind of insurance. The next slide you're going to see is a picture of how asthma affects the different airways. You'll see the first airway picture, the muscle, it's loose, it's open, and then you'll see the next picture, which is the next stage in asthma, where the muscle's starting to tighten and the inflammation you can see in the ring inside the airway. And on the third picture, you'll see a case of severe asthma, where the muscles are really clamped down, there's a lot of mucus in the center, and then you also see the ring that's in the center really inflamed. And those are times where our patients are really not able to breathe, and you're going to have to work really quickly to get them to where they can breathe. Um, Warning signs of an asthma attack before it hits sometimes can include headache, runny or stuffy nose, a sore throat, a call for a slight wheeze after exertion or exercise, difficulty sleeping because they can't breathe that well. These patients may feel restless, moody, irritable, just because, they can't breathe. How else are they supposed to feel? And then also, these patients often feel tired and weak after a lot of exertion or exercise. But again, they can't breathe as well as a normal person with nothing wrong with any of their airways and no history. So, of course, they're going to be a little bit more tired and they're going to have a little bit more coughing, wheezing. Sometimes you'll even hear upper airway stridor, which is their upper airways even got inflammation in it. Then next we're going to continue into the symptoms of an actual asthma attack, which are chest tightness, excessive coughing, especially at night when laughing or after exertion or exercise. You're going to see these patients have difficulty breathing, shortness of breath. Their sleep patterns are going to be interrupted because they're going to have trouble breathing during the night. A wheezing or a whistling sound on inhalation or exhalation. It's because of the airways are tightened down, the muscles are inflamed, you've got mucus sitting in there. They can't breathe as like normal people can. You might have little to no air movement in the bases of their lungs during inhalation or exhalation because those airways are, again, they're tight, they're clamped down, they're not getting the oxygen they need. They may feel what we call a feeling of impending doom or increased anxiety, where they just feel like something's going to happen. They know something's bad coming. These patients may sweat a lot. Also, these patients can use what we call a tripod position, which is normally their hands on their knees, and they're hunched forward, trying to breathe more because they feel like it's opening their lungs up more. It's giving them more space to breathe, when in reality it's not doing a whole lot of anything but just making them halfway feel comfortable for it. Again, these are just some of the signs and symptoms of what can happen before and what happens during an asthma attack. Each patient will present in their own way. Next, I'm going to turn it over to Carly, who's going to go over the pathophysiology of asthma and the diagnosis of asthma. Thanks. Have a good day.